All right, we are going to go ahead and get started. Good afternoon, everyone, and welcome to our annual panel on healthcare. This is what you need to know about healthcare at RiverWoods Exeter. My name is Lisa Clark, and I am sales manager here. I will be facilitating the conversation today with our guest panelists. We will be recording this event, so it will be available on our website if you want to view it later, or if you want to share it or direct other people to it. We would love that. We do have everyone on mute today, but we do always welcome your questions, and we will take questions at the end. You can submit your questions through the Q&A box at the bottom of your screen. If you have any suggestions on how we can improve these webinars, we would love to hear from you, including if you have any other topics that you think would be of interest to folks. We would love to hear that as well. Now, a lot of those of you joining today are on our wait list at RiverWoods Exeter, so some of this information will be familiar to you, but we do have people joining who are not as familiar with RiverWoods Exeter. So we just like to do a little walkthrough about who we are and what services we provide. So RiverWoods Exeter is a life care community, which is actually an insurance product. We are considered a long-term care insurance product. Because of that, our contracts are regulated by the state in which we operate. Our financial performance is reported to the state annually. And when you come to live at RiverWoods in independent living, you're actually prepaying and insuring for your potential future healthcare needs in assisted living, memory support, or nursing. Because you are prepaying for your future healthcare needs, a portion of the entry fee that you pay when you come to live here, as well as a portion of your monthly service fees, are tax deductible. And it's really a choice around lifestyle when you come and live at RiverWoods. You come into the community living independently, so you can give up all the maintenance and the household chores, because we take care of all of that. We take care of transportation and getting you to medical appointments. And we also have a lot of activities and programs here to keep you informed and entertained. A lot of socializing happens here, which is so healthy for all of our well-being. But really, you continue to stay in control of your life while getting support when and if you need it. We were founded by these two lovely ladies, Mariana Hatch and Rosemary Coffin, who started planning for this community in the early 1980s. Their goal was really to find a place where they could age and not have to worry about their healthcare needs, that they could have access to community and friends and activities. And over the course of the time, they not only developed RiverWoods Exeter, but we also now have two other communities in New Hampshire, one over in Manchester and as well as one in Durham. All three of these communities are governed by a CCRC board that stands for Continuing Care Retirement Community. And that is the board that oversees our, excuse me, our operations. It is comprised of a handful of residents as well. And then we also have our system board, which oversees more strategic initiatives for our three communities and focuses on our future growth of the organization. All three communities are supported by the RiverWoods Group, which provides services like human resources, quality, finance, marketing, and IT. And the RiverWoods Group also is there to support any at-risk projects within the community. So they do have some funding there that helps us fund new ventures that we might want to move into. It is important to note, though, that all three of the communities in Exeter, Durham, and Manchester are financially independent. And they do provide some funding to the RiverWoods Group based on their available assets. All right. So I want to talk a little bit, just set the stage around sort of the evolution that's happening here at RiverWoods Exeter in regard to healthcare. When we originally built our 3 campuses here, we built each one of them with a separate healthcare lodge that is part of the campus. And those 3 healthcare lodges provide these levels of support, which include assisted living, long-term care, and memory support. And then we also currently offer short-term rehab at one of our campuses, which is our Ridge campus. And in the 30 years since we developed this concept, a lot has changed. And we are finding now with the new landscape of employment and healthcare workers that we're finding some staffing inefficiencies with operating 3 small healthcare centers. We have very limited amenities within these 3 lodges. And we're now running into some limitations on technology and being able to incorporate more technology because of the age of our 3 lodges. So we're going through a shift away from 3 small healthcare lodges into one centralized healthcare center that will provide all the same levels of support of assisted living, long-term care, short-term rehabilitation, but we will also now have distinct memory support residences. So that'll be a plus in this new space. And the design of it is going to be really beautiful. You'll see this word on the screen, biophilic design, which really is a way of bringing increasing residents' connection to nature, either directly through courtyards and rooftop decks, or indirectly with more windows and indoor greenery. So it's a way of designing a building to really enhance the well-being and healing of our residents. We will also have the benefit of incorporating more state-of-the-art technology that's now being used in more modern healthcare structures. And lastly, but really key, is it'll help us solve for staffing inefficiencies by having all of these healthcare workers within one building. It'll allow us to be more nimble and move our staff around as needed as our residents' needs change. This new building is going to be located at the corner of White Oak Drive and Route 111 here in Exeter. You're seeing a couple of renderings here of what we expect it will look like in the upper left, the outside of the building, which will face White Oak Drive. On the lower left, you'll see a rendering of courtyards. So we're looking to have 2 different courtyards, one for our memory care residents and the other for our assisted living residents. So again, having access to outdoor space and greenery. And then on the right side, you're seeing a rendering of what the lobby might look like with nice high ceilings and greenery and a coffee shop and places where people can mingle and feel comfortable just sort of hanging out. So we are in the process right now of working with the planning board for the town of Exeter on getting approvals for this centralized healthcare center, and hopeful that we can start the construction on that in the middle of this year. All right, I'd like to introduce our panel today. We have really aimed to have a spectrum, a representation from the broad spectrum of services that we provide here, starting with our independent living and our wellness clinics, all the way through our skilled nursing area. So I'd like to introduce Emily Stewart, who's our nurse practitioner of our wellness clinic, Dennis Donovan, our social worker, Dr. Timothy Keenan, who's the medical director for us, and then Dennis Deneen, who is our regional director of clinical services. So I'm going to have ask them each to kind of introduce themselves and give you a sense of what they are focused on, what their background's on. And so I will turn it over to Emily to start that conversation.
Thank you. Hi, everyone. As Lisa said, my name is Emily Stewart. I am the lead nurse practitioner for the wellness clinics at RiverWoods Exeter. So a little bit about my own background. I originally went to school and got my undergrad and my master's in psychology from UNH. I then did a pretty good sized pivot, got my master's in nursing, from the MGH Institute of Health Professions. I'm a board certified nurse practitioner with a dual certification in adult and geriatric primary care. I have my doctorate in nursing practice, also from the University of New Hampshire. And I've spent the last decade plus in a variety of roles in senior living, assisted living, and skilled nursing type settings. I have worked here as the nurse practitioner at the Ridge campus at RiverWoods Exeter since 2017. And then since last summer, last July, have been the lead NP for the 3 wellness clinics at RiverWoods Exeter. So that is a little bit about my background. And then I think we do the other intros first before I start talking about wellness clinics. Okay, great.
Hi, I'm Dennis Donovan. I'm a social worker. I've been here at RiverWoods Exeter for 15 years. I have over 33 years experience as a social worker in long-term care. And I'm also a licensed nursing home administrator. We have 4 social workers here at RiverWoods Exeter. We have 1 in each building located in the lodges. And then we have 1 social worker that is a wellness social worker, works out of our 3 wellness clinics and with a primary responsibility of working on transitions through levels of care.
Good afternoon. My name is Dennis Deneen. I'm the Regional Director of Clinical Services for RiverWoods. I work out of the Quality Department, and I provide clinical oversight to RiverWoods Exeter, Durham, and Manchester. I am a master's prepared registered nurse, having graduated from Norwich University in Vermont, an undergraduate degree also in nursing. I also hold licensure as a nursing home administrator, and I am an infection preventionist. I come from a long-term care background. I've been working in long-term care now for about 30 years, and have joined RiverWoods in the last, I think it's 3 months now, just about. I definitely come with a lot of experience in being able to provide oversight of regulation and clinical services within each community.
Hello, my name is Dr. Timothy Keenan. I'm a board-certified family medicine physician. I went to medical school in Syracuse, New York, and did a residency in family medicine in Wilmington, Delaware. I've lived here in the Seacoast now since 2006, and I'm a contractor as medical director with RiverWoods. I'm not a RiverWoods employee. I'm part of Core Physicians, which is a multi-specialty group here locally as part of Exeter Hospital and Beth Israel Lahey Health System. I've been taking care of patients at RiverWoods since 2006, and I became the medical director here in 2014, so just over 10 years. And my role is to take care of patients that are in the skilled or enhanced assisted living sections of RiverWoods. If they are not able to get out and see their own physician, or if their physician does not come here on campus to see people, then I would assume take over their care in their place of living here. I'm typically here on 2 half days a week, and then the rest of the time I spend in my office in Stratham, New Hampshire. I also serve as a resource for Emily Stewart and the other nurse practitioners if they have any questions, concerns, needs, and we collaborate on quite a number of patients, whether they be patients in my panel or other patients. And I'm available to assist the directors of nursing at each of the campuses if they have any concerns about any particular patients. I can consult on those situations and help them as well. And I serve as part of the quality committee as well to make sure that we're giving the best possible care that we can at RiverWoods.
Great. All right. Thank you all for your introductions. We're going to move on now and talk about the different, specifically the different types of services that you would have access to here at RiverWoods Exeter. We're going to start with Emily and talk about the wellness clinics and how they support you in independent living.
Sure. So there are 3 campuses to RiverWoods Exeter. Each of the 3 campuses has its own wellness clinic, staffed by a nurse practitioner and 1 or 2 registered nurses. We're open Monday through Friday, and we have a period of walk-in hours Monday through Friday, where folks can walk in and sort of have an urgent care type style. So diagnosis and treatment of minor illness and injury. That's your bumps, your bruises, your upper respiratory infections, that sort of thing. We also assist with a lot of folks here with monitoring of their chronic conditions, and doing a lot of communication back and forth with the resident's primary care provider, often with core physicians. We also have quite a bit of nursing assistance available. So one of the main things we do is weekly medication planners for folks who either may not want to manage their own meds anymore, or maybe are starting to have some trouble with that. So you pick a day of the week and you get your week's worth of medicine in a planner handed for you. And then you just have a standing date to come back the next week, switch out the empty one and get a full one. And so we assist with medication refills, and a lot of folks have given us some good feedback about that service. We do a lot of communication with the primary care providers, like I mentioned, and also the specialists. So if you have a cardiologist or a pulmonologist, or maybe you need a referral to dermatology or that sort of thing, we try to help advocate and coordinate those needs. And we do a lot of assistance with transitions of care. So that's when it does come time to consider moving from independent to assisted living or enhanced assisted living. We assist with that, along with, as Dennis mentioned, our social work department. We also have an additional service that is a fee-for-service, that is a home health care, essentially agency. It's available Monday through Friday. And that provides more homemaker type services. So maybe some assistance with meal prep, maybe, if someone eventually needs a bit more help with things like showering or dressing, that sort of thing. We do have a home health program available as well. And we're looking to hopefully expand those services. That is a service that's available by appointment only, with an additional fee for that service. So that's essentially the very quick summary of the wellness clinic. I think Dennis will speak next to some of the social work things, and then I'm happy to take more questions about the wellness clinics if there are some.
Hey, so as our vision statement says, the social work department provides support for our residents, their families, and for each other, our staff. Like I said, the primary responsibility of our wellness social worker is to work on transitions, people moving from their independent apartments to assisted living or to our nursing center. Those conversations sometimes start well in advance. I mean, we might be meeting with residents along with the nurse practitioners months, sometimes even more, just talking about changing needs and what that looks like. And, it gives us an opportunity to look at some of the support we can provide people in their independent apartments. We want people to be as comfortable as possible, but we want to make sure they're getting the care and support that they need. We also, the social work department also works as a liaison to the area hospitals. So when one of our residents from all 3 campuses goes out to the hospital, we're on the phone with the hospital right away, making sure we're working with them to ensure when the resident returns that they're going to get whatever they need, whether that's additional services in their independent apartment, or if they need to come to our health center for a short stay. We act as advocates for our residents, and we assist with referrals. We meet with people and talk about their needs as far as mental health services are concerned, any support that they might need in their apartment. We can work with the NPs or with their primary care physicians to make sure that they're able to get those things. If it comes time where somebody is in need of hospice services, we assist with those referrals to make sure they get that support. We do some brief individual counseling, and in some cases, we do some brief couples counseling. But we also can refer people out for different mental health services outside of RiverWoods. We assist residents with advanced directives. One of the things we do when people move in is we take a look at what their advanced directives are. That would include any power of attorney for healthcare, living will documents that they've done, or anything that's talked about what they want if they became unable to make decisions for themselves. We review that, make sure that their wishes that are stated in those documents haven't changed. And if they have, we can redo that with them. We also provide a lot of support for our staff. I mean, as you can imagine, healthcare can be a difficult place to work. Our nurses' aides, our nurses, they work very hard, and sometimes they just need someone to show them some TLC and support. So that social workers are able to do that. We run a lot of support groups. Right now we have a Parkinson's support group that's been going on for about 11 years. That's a monthly meeting. We have two caregiver support groups. We have a low vision support group. We are getting ready to start a support group for people that have different chronic conditions. Instead of having support groups aimed at different diagnoses, we found that a lot of the support that people need is the same across a lot of different chronic conditions. And we thought we would take advantage of that and work with our the social workers working with the nurse practitioners to run that support group. And we're also looking at doing a grief and loss support group, which could be, for people to come and receive some support for a shorter periods of time, and hopefully it's referrals keep coming in, and it's a program that would stay active for a long time. That's it.
Hey, Dennis, I just want to incorporate a relevant question from the queue. That it is a question about hospice service and whether it's provided on site at RiverWoods.
Absolutely. Yeah, we do hospice. Hospice will come in. Right now, we have contracts with a number of different hospices, but we would do a contract with any hospice that someone wanted to use. People are able to have hospice services in their independent apartments, in assisted living apartments, or in the long-term care units.
Great, thank you. Okay, thank you, Dennis, for that terrific summary of what your team provides. We're going to move on to Dennis Deneen and dig a little deeper into the other levels of living at RiverWoods Exeter.
Okay. So I'm going to talk with you a little bit about assisted living and traditional assisted living. And what that means is that you have 24-hour a day, 7-day a week nursing availability in the event that there's a medical or activity of daily living need that one might have while they're in assisted living. The nursing staff is comprised of licensed nurses and licensed nursing assistants, and they are there to provide assistance with activities of daily living, which may include some assistance with bathing, dressing, or toileting. The nurses will provide assistance with medication management by either administering medications for the resident or supervising self-administration of medication for the resident. They'll also do medication teaching. So if there's a new medication that's ordered for a resident, they can do some teaching about what the medication is for, potential side effects to be looking for, et cetera. So that's one of the things that they're able to do. Generally, for an assisted living resident, you've got to be able to transfer, walk, or self-propel independently or with supervision, meaning that if you are unable to perform those tasks, the traditional assisted living may not be appropriate for you. And that's where we'll talk about a different level of care. But importantly, anyone coming into assisted living needs to be able to ask for help. And so from a cognitive perspective, you need to be able to know that you need help and ask for that help. But then functionally, you need to be able to use the call system to be able to get that help. Because if you're behind a closed door in an apartment, no one can see you. So therefore, being able to call for help and know that you need the help is really important. Enhanced assisted living is different in the sense that it provides more comprehensive nursing care. And it's generally equated with looking at more of a long-term care or skilled level nursing care. And here you may require assistance with many or all of your activities of daily living. So it may not just be that you need some assistance with bathing, but you also need assistance then with dressing and transferring and toileting. And in some instances, maybe even getting in and out of bed. We do provide assistance with mobility and transfers in that sense. Medication management in enhanced assisted living is generally done by a licensed nurse or a medication nurse assistant who will provide those medications at the prescribed time. In addition, there's frequent rounding, and rounding is just providing visual observation of all of the residents who are living within the assisted living unit. Because part of the reason why you would be in an enhanced assisted living unit is that you may not be able to call for help when needed. So this way, staff are able to hopefully anticipate some of the needs that you may have. Additionally, it is an increased staff to patient ratio in comparison with your traditional assisted living because the level of care would be slightly more detailed. Skilled nursing care, which is something that many people may be familiar with. Skilled nursing care is a level of care that is just basically one step below an acute rehab. So in skilled nursing, it's done at Suncook Lodge on the Ridge campus in Exeter, excuse me. And skilled nursing is overseen by both the Department of Health and Human Services in New Hampshire and also the Centers for Medicare and Medicaid Services through the federal government. Residents who come to skilled care may qualify for a what we call a Med A skilled nursing stay, by where they've had 3 qualifying overnight stays in a hospital. But we provide the same level of care in skilled care as we do in enhanced assisted living. You're eligible for physical therapy, occupational therapy, and speech therapy, which are all covered under a Part A Medicare benefit. However, residents who come in who are not utilizing a Medicare A benefit would get the same level of care through their enhanced assisted living stay. The staffing ratios there are a little bit different in that there are requirements for registered nurses on duty. And so you would see registered nurses, licensed practical nurses, medication nursing assistants, and licensed nursing assistants, all providing care. And the ratio of staff to resident is similar to that of the enhanced assisted living. And the traditional long-term care residence is available as well for residents at the Ridge. So those residents are basically residing in the same area as the skilled residents.
Thanks so much, Dennis.
Mhm.
We're going to transition to talk about respite stays. I believe Emily was going to give an overview of this.
Sure. Yep. So a respite stay is a short-term stay, usually 30 days or less, with the intention that the person is going to then move back to a different level of care. So the respite stay itself does not describe the level of care. The respite stay describes the fact that it's temporary with the intention of the person going to a different level of care. So you can have a respite stay in assisted living. You can have a respite stay in enhanced assisted living as well, really depending on what the needs of the person are. So some various reasons for respite stays might be that the person has had a hospitalization or an acute illness. They were not in the hospital for 3 nights. They don't have their Medicare A benefit in place here. But they would then be able to go to assisted living or enhanced assisted living and receive that extra care that they might need for a short period of time. It could also potentially include some physical therapy, occupational therapy, speech therapy, etc., that would be being paid for by the person's Medicare Part B benefit on an outpatient basis. Another reason we might use a respite stay is for caregiver respite. So we also have quite a few, often couples in independent living who perhaps one spouse is the caretaker and the other person needs additional care. And so perhaps if the caregiving spouse is either unable to care for the other spouse for a period of time, or maybe they're going away for a period of time, we provide respite care for that spouse who needs additional care. So there are, quite a few different scenarios where someone might end up in a respite stay situation from independent living or from assisted living. Perhaps they need to go to enhanced assisted living for a short period of time and then come back to assisted living. So that's sort of the general summary of a respite stay. And again, happy to take some questions in the comment box there if folks have them.
Great, thanks, Emily. Okay, we are going to transition now into the question and answer session. If you have questions, you can put them into the Q&A box located at the bottom of your screen. I think we'll roll right into a couple of similar questions about the wellness clinics and the nurse practitioners there. The wellness clinics, the question is whether the wellness clinics are moving to the new centralized healthcare building. And the answer is no, they will remain at the 3 respective campuses because Emily and the other nurse practitioners support the independent residents. So that's where those clinics will remain to support those residents in independent living. Okay, we have a question about what is the availability of primary care physicians in the Exeter area, and how long can we expect to wait before getting a first appointment with a primary care physician after moving to RiverWoods?
So I can take that question. Currently there are physicians and nurse practitioners that are taking new patients in our immediate area, in the Exeter area. The largest group being core physicians, which is part of Beth Israel Lahey Hospital System, part of Exeter Hospital. There are a few independent physicians and a few independent nurse practitioners that have their own practice in the Exeter area. And then there are physicians in Dover around the Wentworth Douglas Hospital System and providers in Portsmouth area around the Portsmouth Hospital System that are taking new patients as well. It is a little bit of a challenge, but I will say that when I talk to people in other areas of the country, even in other areas of New England, we're actually doing better than most as far as being availability goes. If we have people that are moving to the area, we do encourage people to start looking right away. Just as if I have patients that are in my panel now and they're moving away to different areas, I always encourage them to start looking immediately, because it can be a while. Sometimes it can be several months before you might be able to get first visit. I can't speak for the other hospital systems, but I know with core physicians, we actually do have a nurse practitioner who does intro visits virtually. So we'll sometimes meet with a person with very short notice to at least talk about what their medical problems are, help decide what medical records are needed from your GI doctor, your primary care doctor, give some refills if you're not able to get that first in-person visit for a few months. At least they can give 3 months worth of refills. So we have that first intro that can happen online, fairly quickly to help somebody get the process started.
Great. Thank you, Dr. Keenan. This next one is for you as well. Will Dr. Keenan act as a primary care provider for any resident upon request if that resident moves from another region and has no doctor?
So currently that's only true for people that are in the EALU or the skilled section. My particular panel in Stratum is closed because I do spend a good part of my time at RiverWoods, so that I don't really have as large of a panel in my practice in Stratum. So I am not taking new patients at this time.
Okay, thank you. This next question is about the wellness clinic. Have we considered extending walk-in hours for the wellness clinic? And what about injuries that might occur in the afternoon or the evening?
Right. So people get hurt at all times of the day and night. That is very, very much true. So have there been considerations made to expanding the walk-in hours of the wellness clinic? Yes. More to come on that. Currently, right now, the walk-in hours are in the mornings, but the NPs are here from about 8 to 4, Monday through Friday. So we also do visits by appointment as well. So often, if you can call us and leave us a message, we will get back to you and be able to see you the same day. The reason we keep the walk-in hours limited to the period of time in the morning is because the NPs are also supporting on healthcare. We are in meetings such as this one. And so we have some other responsibilities where we're trying to sort of navigate where we can, how we can best use our time. And so for things that can wait to a walk-in hour, we certainly would have, excuse me, you come in, Monday through Friday during that time period. However, if you have questions, if you have something you want to be seen for at a different time, we certainly welcome that by appointment. And then we do have our e-call system. So if you have something that is, an urgent need, regardless of what time of day or night it is, we would ask that you press your emergency call pendant. You would get a nurse and security responding. They can, in the event of an emergency, assist with getting EMS to you. And in the event that it is not an emergency, often it's just a little bit of reassurance from the responding nurse that, hey, you can follow up with the wellness clinic in the morning. Just wanted to also mention that we do our best to be available, certainly, but we're not a primary care practice. So we don't have, on-call coverage when we're not here. We would always give you the option to call your primary care provider, which does have on-call coverage, typically 24/7. So we're always having conversations like that to make sure that someone feels comfortable, going for the weekend. We often have a conversation like, what is your plan for the weekend? What are you going to do if you feel this symptom or that symptom, to try to help people feel prepared and know what they can do if we're not here.
Great, thank you. So question about the home health care, enhanced home care, Emily. We have a question about what company we're using for private pay home care services, which may not be the same as enhanced home care. Can residents choose a different agency if they prefer? Same question for hospice care.
So you can absolutely choose your own home health company if you prefer. There are several in the area. And you can absolutely choose any home health that you would want to enroll in. That's perfectly fine and happens all the time. The enhanced home services that I referred to, that is a home health service, is actually a RiverWoods service. So the LNAs who provide that care are RiverWoods employees. To use that program, you would sign on to this additional service in the same format and style that you would sign on to an external outside company. It's just that it is through RiverWoods and they are RiverWoods staff members. Oh, and hospice, what was the question on hospice? Yes, you can elect any hospice company that you choose, if you have a preference.
Great. And a related question, is the home service billable to Medicare?
I don't know the answer to that for the outside companies. I believe it's typically just a fee for service that does not bill Medicare. I can speak to the RiverWoods based service, which is no, we do not bill Medicare for that service. I do know of a few folks who have a private long-term care insurance who will submit their bill to that and will get reimbursed for it, but not Medicare.
I know that if one of our residents comes out of the hospital and goes home and doesn't need to come to a healthcare unit, there may be some nursing services that are covered under their Medicare post-hospital, but that would be short term.
Great, thank you. We have a couple of insurance questions. I'm not sure if we have folks on the panel who can answer this, but I'll throw this out there. We have a question about medical insurance. My Medicare plus Blue Cross Blue Shield is from the state I currently live in. Do I need to transfer to get that from New Hampshire? Okay. Anyone?
Medicare is federal, so Medicare works wherever you are. You can walk into any office or health clinic in the country, and they'll probably take your Medicare because it's a federal program. And most secondary insurances will cover you wherever you are as well. They're a portion of it. There could be some exceptions to that, so you should probably just contact your secondary insurance carrier and find out specifically if you're making a move to another state, whether or not there are any restrictions.
Yep. And when you are offered an apartment or a cottage here at RiverWoods, we will ask for copies of your insurance cards, and we can work with our medical billing person on staff to answer questions like this to make sure that that your insurance company will accept billing for services provided here, if appropriate. Okay, we have a question about memory assistance, memory care, and what sort of services are provided in regard to that.
So on the healthcare units, we do a lot of program that's geared towards people with cognitive impairments. We do that through our activities programs. The social workers do some one-on-one supportive casework with people. We don't have our new healthcare, centralized healthcare will have a memory care unit that's allotted just for that level of care. But we pretty much have to do that level of care in all of our healthcare units now. So it's person-centered care. So if we have someone that requires that type of care and interaction, they get it wherever they're living.
Great. Thank you, Dennis. We have a question about what percentage of residents at RiverWoods are in assisted living or enhanced assisted living. I don't know if we have a percentage. I think we have a little over 500 residents living in independent living and I think around 100 in some level of health care. Does that sound right?
Pretty close, yeah.
Okay, great. So we have a question about what are the current staffing challenges, and do you have any plans to change from a type A to a different type of CCRC? And please run down the care types that will need an extra charge. So who would like to speak to staffing?
I guess I could tackle staffing. And I think the question was regarding challenges with staffing, which as most healthcare entities are experiencing, trying to find qualified licensed nurses and nursing assistants is always a challenge, and became even more so through the COVID pandemic. I know that RiverWoods has a very robust recruiting and retention program in place. If we look, actually, I was in a meeting yesterday where we were talking about staffing and how did RiverWoods compare to other entities or other organizations in the state. And our vacancy rate is actually much lower than many of our other senior care providers in New Hampshire, because we have such a robust recruiting and retention process. I think that generally once people come into RiverWoods and they see how wonderful it is to work here, and it's a great working environment for our staff, they enjoy it and they don't want to leave. But I think, from a recruiting perspective, having come just from the skilled nursing side of things, recruiting is very, very difficult because we are in competition with other skilled nursing facilities and the hospitals to try and get staff. And unfortunately, folks coming out of school are not coming out as fast as we need them to enter the field. So it does pose that challenge.
Great, thank you, Dennis. The question, do we have any plans to change from a type A to a different type of CCRC? Not that I am aware of. The beauty of the type A contract is that we will, cover you for any level of healthcare that you require here at RiverWoods. If there are certain services that we can bill Medicare for, we certainly will. But there shouldn't be extra charges to you for the services that we're providing here. We have a question about what is now and what is in the future, and this is related, I think, to the current state versus future state of our healthcare centralization. So we expect that our healthcare building should be completed in about 18 months from when we break ground, which we're hoping will be mid-year this year. And then what I omitted in my earlier part of the presentation is once we move our healthcare residents into the new healthcare lodge, we will actually be repurposing the former healthcare lodges into more independent living apartments. And that will take another couple of years after we've moved those residents into the new building. We have a question about, will the new healthcare center provide the option for a couple where both require skilled nursing to continue to reside together in the same room?
I would believe that that would be the case. I mean, under federal regulation, we have to provide accommodation for married couples if they choose to reside together. But I'm not 100% sure about the room setup insofar as whether they're going to be all private rooms or if the apartment size will accommodate 2 persons. So I apologize, but I can't answer that question.
Yeah. Thank you, Dennis. I know today our skilled nursing rooms will accommodate just one resident. We do have some enhanced assisted living, or excuse me, not enhanced. We have some assisted living apartments that are 2 bedrooms that can accommodate couples. But I think, as Dennis alluded to, we're still working through some of those details about the room sizes and the architecture and some of those details, but certainly we'll be sharing more. I want to shift to, go ahead.
I was just going to say, the way things are right now, we certainly make every effort to allow for people to be as close as possible to each other. If they're not able to be in the same unit, like in our enhanced assisted living or skilled nursing, we make every effort for them to be as close as possible.
Great. Thank you, Dennis. I want to shift to some questions we have around transportation and the services we provide to get people to medical appointments. When you're living in independent living, we have a transportation team that can get you to medical appointments within a 25-mile range. I have a question from somebody calling out Dover and Wentworth Douglas practice. I believe we get residents up to appointments at Wentworth Douglas Hospital. And then a question about if they needed to go further than that, like Boston or someplace, some specialists that may be a little further away. How is that handled?
I will, just speaking from the wellness clinic perspective, I will say that Boston appointments for folks who don't drive or don't have close family or friends to drive are certainly challenging. And what we have utilized is to help people find private drivers. It's been pricey, but effective.
Great. Where do residents typically go for specialist care that might not be available at the local hospital?
Sure, I can take that one. So fortunately, we do have most specialty needs fulfilled within our area between the 3 local hospitals. Just about every specialty is taken care of. And several of the specialties, we have we're really in a beautiful area as far as the fact where we've got most of what we need right here, but when we don't, Boston's an hour away. So that has really been very, very beneficial for us. For example, we have great teams of cardiology at each of these locations, interventional cardiology for stents procedures, bypass surgeries, valve replacements. But there are some more advanced type things, like if somebody has a larger aneurysm, around the heart, or needs special ablation procedures, what they call electrophysiology. We have the Boston hospitals, and we've utilized Beth Israel Lahey as well as Mass General, quite a bit. And a little bit less commonly, Dartmouth, and then also Catholic Medical Center and Elliott in Manchester. At times we have referrals to. So again, most specialties we're doing very well. I mean, hematology oncology is at Exeter Hospitals connected with Beth Israel, and you can get just about every need you hear for heme or onc. But if you and they are, of course, connected to those tertiary care facilities for any more advanced treatment, or if you need to see a super specialist in a particular rare type of cancer. And the same with Mass General Hospital being associated with Wentworth Douglas. Same idea. If you could see Mass General cancer specialist, but get your treatments at Wentworth Douglas, locally, or have your MRI done there. And it's so hard for all those people on the call that are in the Boston area. It's so hard to keep track of who's partnering with who. But Beth Israel, which is associated with Exeter Hospital, is now getting together with Dana-Farber and building a brand new cancer hospital. So it's, again, hard to figure out who's with who. We have just about every need for specialty in this area. I will tell you there's a national shortage of a couple of things. We are suffering a bit with neurology. Neurology wait times can be pretty significant. Some cities are completely absent of neurology. Right now, we are utilizing a group in North Shore Neurology just over the border in Massachusetts, Wentworth Douglas Neurology, and Beth Israel Hospital Neurology in Peabody and Burlington. So those are the neurologists we're using, but that has been a struggle for sure. The other struggle is psychiatry. There is a national shortage of psychiatrists, so there can be sometimes difficult getting people established, but we've always been able to do so. It just sometimes takes a little bit longer, and we have to, when we identify those needs, start working on those type of referrals. Every other specialty doing pretty well. And then the specialists here have access to specialists in tertiary care when they feel that there's something that's a little bit beyond what the local hospitals can handle.
Great. Thank you, Dr. Keenan. So we have a question about, does a wellness program offer support for those who manage their own insulin or anticoagulant medication?
So as far as anticoagulant medication, I'm assuming the person is referencing warfarin or Coumadin, and maybe testing themselves at home. So I would typically defer the monitoring, the dosing of the Coumadin warfarin to the primary care provider, just for continuity of care purposes, but we can certainly assist with helping get those numbers to the PCP and or actually doing the finger stick if that's something that the person needs assistance with. And I believe this a similar question for insulin. We can certainly assist with some blood glucose monitoring, with some lab work, with communication with endocrinology and primary care. We would not be available in independent living to be doing something like 4 times a day insulin dosing or 6 times a day insulin dosing. We would be there, more on a as needed basis, or for someone who has a scheduled standing order to say, come see us for blood sugar checks a couple times a week or something like that.
Great. Thank you, Emily. A couple more questions here. We have a question about repeating which of the expenses would be tax deductible. So with a continuing care retirement community, the non-refundable portion of your entry fee qualifies as a prepaid medical expense and would be eligible as a deduction. And then about 1/3 of the monthly service fees that you're paying when you're living in independent living also are considered to be a prepaid medical expense and could qualify as a tax deduction. We have a question about urgent care clinics in the area. Are they there?
Sure, they can take that. And there are several different companies that have urgent care. Clear Choice MD and Convenient MD, I think, are the 2 most common, but there are several urgent cares available.
I would also add that we have an orthopedic urgent care locally that we utilize a lot for folks who have had joint injury, and they do typically will do an x-ray right on site at the same time you see the provider, and they are on a walk-in basis, so they've been very helpful.
Thank you. We have a comment from one of our well-informed participants today. If you have a Medicare Advantage plan, you may have to change your plan if you're moving out of that plan's coverage area. I know that some of the new residents I've moved in have needed to change their plan to something that is more local. If you have a long-term care insurance plan, some people do move here with plans like that. You can keep it. And when or if you go into healthcare, you can file claims and get some reimbursement from your long-term care insurance policy. Many people discontinue their policies, but it really depends on how much you're paying for that policy and what the benefits are. We do have someone on staff here who can meet with you to review the options with that. And we always recommend that people retain their long-term care insurance for the first year that they're living at RiverWoods to make sure that you're settled here and happy before you get rid of it. Another question here about what conditions might develop or occur that would require someone to move out of RiverWoods to be treated.
I guess I will say, to my experience, that has never happened that I know of. What I am picturing as a theoretical is that if there was a situation of someone truly being a danger to themselves or others, that is something that we would not be able to, support. But I feel like as far as pretty advanced medical conditions, I've not had experience with anything that has required an individual to move out of RiverWoods.
As long as we're able to provide the care, we will continue to do so.
Great. What happens if one resident needs assisted living and the other does not? What are the options? I'll answer this. The options are for one resident to move into an assisted living apartment while the other person remains in their independent apartment. And oftentimes this depends on what's happening medically with the partner who needs more support. Occasionally, I think, and Dennis, you could confirm this, we do have residents moving together, but it's probably more typical that one resident would move while the other remains in independent.
Yeah, usually the timing is not always in sync as far as what their needs are.
Right, right. So we have a couple of questions here that are in regard to the status of the new healthcare building. So if you're in the local media market, you've probably seen some articles in the local newspaper about this. You know, we definitely have some concerns of abutting neighbors that we are working to address. We have met with the town planning board a couple of times. We have another meeting coming up in February. So we are working up some solutions to address concerns around landscaping, building size, things like that that have to do more with the size of the building and the visibility of the building from Route 111. So, you know, we have the building largely designed, but we're making some modifications to that as well as to the landscape design so we can address some of the concerns among community members around that. So our plan is still that we're moving forward, but we're trying to make sure that we've got all of those concerns addressed. Let's see. Last question here, and then I think we need to wrap up, is I've had a couple of questions still about, are there any additional healthcare costs when somebody moves over to a higher level of healthcare? And this would be costs that, you know, maybe Medicare or supplemental insurance may not cover.
So from an independent perspective, the wellness clinic is included in your monthly service fee. If you do have a visit where the nurse practitioner, you know, sees you for something that you could have gone to an urgent care or your primary care for, we do have the capability of billing your Medicare in the same way that an urgent care or your primary care provider would have done so. Otherwise, there are no charges to use the wellness clinic. The enhanced home services, which is the home health program, is a fee for service program. So that we had discussed already, but that is $36 an hour at this time. I'm sure that could potentially change, but that's where it's at right now. And then I'll let Dennis speak to the other healthcare costs, which I think, spoiler alert, is mostly just the meal plan, but you go, Dennis.
So when someone transitions from independent over to assisted living or to enhanced assisted living or to skilled nursing, the only additional charge they have is for 2 additional meals. There's a New Hampshire state law that assisted living and nursing facilities have to provide 3 meals. So there's an additional charge for 2 meals per day for 30 days. But your monthly service fee covers the care and support you need without any additional charges. If you require some new equipment like walkers or a wheelchair or anything like that, there could be charges that some of that might be billed to your insurance, some of it might be out of pocket. But as far as the care and support that you require and that we're providing, there are no additional charges for that.
Great. Thank you. All right, so I want to tee up our next online workshop. I have a screen here if you want to take a picture of that QR code and register for our annual downsizing workshop. This one's called Keep the Memories, Lose the Stuff. And we always get a lot of interest in these webinars that we host annually about how do I get rid of all my stuff so that it'll fit into RiverWoods Exeter. Matt Paxson, who was host of the Legacy List on PBS and formerly host of Hoarders, will be joining us on February 20th at 1 o'clock. This session today will be or has been recorded. You will be sent a follow-up email with a link to that recording, and we will also be posting it to our website. And I want to thank our panelists today, Emily Stewart, Dennis Donovan, Dennis Deneen, and Dr. Tim Keenan. Thanks so much for sharing your expertise with folks today, and look forward to seeing you all again in the future on another webinar. Have a great day.